You're tuned into Inside Lowell. Inside Lowell podcast brought to you in part by Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank. UniCare, offering a variety of plans for people insured under the GIC. At UniCare, your health is their top priority. Boston North Company, offering a wide variety of business solutions to help restaurant and retail clients save money. Boston North. Mahoney Oil Company, providing warmth and protection to families in Greater Lowell and Southern New Hampshire since 1925. That's Mahoney Oil. Francis E. Preventia Insurance. For auto, home, business, and life, trust the agency Greater Lowell has counted on for more than 40 years. Francis E. Preventia Insurance. GoPuff, a grocery store right at your fingertips. Use the code Lowell20 to receive $20 off your first order of $21, plus free delivery. Download the GoPuff app or visit gopuff.com today. And by the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Tsonga Center in Lowell. Get your tickets today by visiting masspiratesfootball.com. And now, time for another Inside Lowell podcast. Inside Lowell. If Lowell is your home, this is your place.
Hello again, everybody, and welcome to another Inside Lowell podcast. I am your host, Teddy Panos, coming to you for the last time from the Inside Lowell Studios here in beautiful, historic downtown Lowell. Don't worry, not going away, neither is Inside Lowell, but the Inside Lowell Studios are, and I'm going to tell you in a quick moment why. But first, I want to thank, of course, you for joining us here on this podcast. Also want to thank our sponsors. You saw a list of the biggies there at the beginning of this podcast who help make all of our podcasts and all of Inside Lowell, for that matter, possible. And we certainly appreciate their efforts to help us come to you and bring you relevant news and information. And on that end, I'd like to bring in my guest for this podcast. He's a fascinating individual who you may or may not know. If you're in the health insurance field, though, you certainly know of David Morales. He is the GM, the general manager at Wellpoint, formerly UniCare. Big announcement last week. Big news. I don't want to say it rocked the industry, David, but it was this was a big announcement that UniCare was changing the brand to Wellpoint. So first of all, welcome. It's great to have you here in our studios.
Thank you, Teddy. It's truly an honor to be here with you and your listeners.
Well, we appreciate that. An honor. Well, I was going to say the other way around. I was excited one night. I was watching a Bruins game, and suddenly the same UniCare logo that pops up on my podcast and on my website popped up on the Boston Garden Ice. I'm like, boy, I'm in some good company here with these guys.
Well, we're certainly honored to be here, and pleasure to have this conversation with you.
Well, good to have you here. Let's talk a little bit about what you do and the switch from UniCare to Wellpoint and why, because it's a fascinating business story, but it's also a fascinating human story and ultimately a health story, because what you guys are doing to keep your members and people in our communities healthy and out of the hospitals, which is where Lord knows what happens once you get in. It's amazing. But first, I want to address the little tease I gave at the beginning. No longer the Inside Lowell Studios. Wellpoint Studios. Wellpoint is actually the naming. You got the naming rights for our studio here, and we'll be starting to slowly unveil. We're going to redesign the studios a little bit and get some of your signage up there, but also start originating our podcast from the Wellpoint Studios. And I am personally excited about this. I've been looking for somebody to kind of step into that role since launching Inside Lowell, and you guys came aboard last September, really, and agreed to do so, but we had to keep hush-hush because you knew that you weren't going to be UniCare anymore and you were going to be Wellpoint. So thank you for that.
Well, thank you. Look, you're a community resource. People listen to you. People trust you. Inside Lowell is an incredible resource, and so we, as a partner in the community, we want to make sure that we're supporting community leaders and initiatives like yours. So we are truly humbled to do it.
And you're everywhere in the community. I think, again, anyone who follows Inside Lowell, between the Health Minutes, sponsored by now Wellpoint, between the classroom quarterback feature each month, putting the spotlight on a teacher in the Lowell public school system who's going above and beyond, to help our kids here. Some fascinating stories are being able to be told. And we should also note that you guys are honoring these teachers, but also rewarding them. You're sending a $250 gift card to all of these teachers to use for classroom supplies or whatever they feel the need to do it for. It's a tremendous investment that you guys have made in our community here in Lowell, in Inside Lowell, and in other communities that you serve. Why is that so important to you?
It's a great question, Teddy. Great way to start this conversation. So first and foremost, Wellpoint, formerly UniCare, is a health benefits plan. And I stress health benefits because we're not a typical health insurance company. We service and support exclusively the Group Insurance Commission. That means state employees, state retirees, or municipalities like Lowell that get their health insurance through the Group Insurance Commission. That is all Wellpoint does. We are the health benefits plan administrator for the state. And so we are proud to be the largest health plan for state employees. We are proud to be the largest health plan for state retirees. And part of that mission, which is to enable, empower our members' health journey, now under Wellpoint, it'll be your whole health is our whole point. But it's the same concept, right? And supporting teachers, supporting firefighters, police, state police, bus drivers, etc. Any public servant is part of our mission to keep them healthy, to enable their health journey, and to provide resources around them to have to empower them to live healthier lives. So we're honored to do that.
Yeah, and there's a number of different ways you do that. And I want to kind of get into that a little bit, but you mentioned you're the largest provider in the Commonwealth. Over 50%, over half of the employees employed under the GIC in the Commonwealth are your Wellpoint customers. In Lowell, that number is even significantly higher. So chances are, if you're a family member of a City of Lowell employee or you're familiar with them, they get their insurance through you guys, right?
That's exactly right. So typically, we're over half of the Group Insurance Commission. Let me say it differently. We service over half of the Group Insurance Commission members. So the basic math is over 50% of state employees are UniCare Now Wellpoint members, and the great majority of state retirees are UniCare members. And so when you're in Lowell, for example, roughly 2/3 of the employees are a Wellpoint member. So we're honored to be here. We're here. We're part of the community. We want to make sure that the members, their families know that we're here to support them.
So this is an incredibly competitive field, I'm sure. We're talking about a lot of people here. How did you get to the point where you are now in terms of your growth? I guess the better way to say it is, what sets you guys apart? Why are you different from the others, the Harvards, the Tufts, and the other players that are in there? And I only know of them because my ex-wife was a state employee, so I remember having these conversations about which plan is right and whatnot. What sets you guys apart? Why is Wellpoint the right choice to make?
It's a great question. Well, first and foremost, as you've heard me say before, I never want to tell people what the right choice is for them. I encourage people to shop. I believe truly in enterprise and commerce, but I truly believe that Wellpoint, formerly UniCare, is the superior product for several reasons. Number one, our customer service. You're going to get somebody from Massachusetts on the phone supporting you. Our customer service satisfaction scores are above 95% every year for the past 30 years. So you're getting exceptional service from potentially your neighbor who truly cares about your outcomes and about your health. Number two, we have a clinical team of over 40 nurses that are available to engage proactively on your health journey to support you. Whether it's to find a health service, to find a primary care doctor, they're there to support your health journey. Number three, our premiums. Other than Total Choice, which we have 4 products, Total Choice Plus, Community Choice, and Medicare Sup, OME. Other than Total Choice, which is the true indemnity model, you're paying a significant premium to do whatever you'd like. No referrals, no gatekeepers. You're free to do anything. No tiering. Plus, the Plus product, Community Choice product are the lowest premium products in the GIC. and the largest, biggest provider network. You can go anywhere. We'll cover you. We're an indemnity plan with no referrals, no need to choose a primary care, right? And so that superiority of a product with the service, with the price point, enables us to offer people an extremely unique experience that's exclusive to them.
So you're being a little bit modest, and for those of you watching this out there, I can tell you in conversations with David, he is a fascinating individual, and I would say one of the largest reasons for the growth, the continued growth of now Wellpoint. But you also have a connection to Lowell, because I know those of us here in Lowell, we always like to think the world revolves around this little city by the Merrimack River. You have that connection. You actually got your start in the political world and became very tight with one of Lowell's favorite political sons, former State Senator Steve Panagiotakis. And you're also, by the way, very tight with our current city manager, Tom Golden, as well.
Yes, I had a long career in public service, about 13 years in the State House and in state government. I worked for 2 governors, 2 different political parties. I worked for Senate President Travellini, former Speaker Tom Finneran. And during that period of my public career, I became very close personal friends with Steve Panagiotakis, who I consider a brother in Christ. We share the faith. We talk often about Bible verses. And he is one of the kindest, most important people in my life. He's just wonderful. Yeah. Tom Golden is just great. Tom is a ball of energy, and he's just wonderful.
And your performance was satisfactory enough that Governor Deval Patrick entrusted you with some important tasks, right?
That was one of my roles in government, yeah.
See what I mean when I say you're modest? You won't brag about yourself at all.
No, look, the reality, Teddy, is that I work at Wellpoint. We have a remarkable team of people whose mission is to care and serve public servants, first responders, and veterans, all state and municipal employees. And candidly, I am the least important player. I can talk a good game, but the team is really the important part of the operation. They're awesome.
All right, you keep insisting that. But so I want to ask, because you said you spent 13 years as a government employee working in public service. How did that, and the fact that you probably had to deal with a lot of the issues that your members have to deal with in choosing a healthcare provider, in deciding exactly which plan is right for them, how did that shape you and how you've kind of shaped Wellpoint today?
That's a great question. I've literally translated my experience in government to UniCare. So first and foremost, I was a UniCare member when I was in government. And so I'm honored to have the responsibility to lead the organization and to serve members. But what I brought over was several things. First of all is a deep commitment to public service and to public servants. Keep this in mind. Folks who work for the state are typically very mission-oriented. And they're servicing us, whether they're driving buses, whether they're driving trains, whether they're teaching, whether they're policing, they're serving us. And so the first point to the team is we serve them. They serve us, we serve them, number one. Number two, I came from a very service-oriented culture during my time in the State House. I served my principals, right, the elected officials. My job was to give them no homework. My job was to do the work for them, right? And so the second principle we have is members do not get homework. We do the work for them. Don't give the members any homework, right? Serve them. So that's number two. And number three, they're our neighbors. We are their neighbors. They're our neighbors. We live here. We own the service we provide. Mm-hmm. So take pride in what we do and make sure that you offer exceptional service, because if you offer exceptional service with affordability, it's going to equal to both growth and retention. That's what I brought over.
It's a complicated thing, and I remember going through this at the time. You see all these plans, you see what they offer, and then you start getting into deductibles, and you start to try to compare them, and it can become daunting. And I would imagine for somebody who just worked a long shift and has to make sure their kids' homework is done, and all that other stuff that goes into adulting, the natural inclination would be, just look at the bottom line. What's the cheapest plan? Yeah. And let's go with that one. Take take us through how you guys kind of support your members in making that first decision, which plan is right for them, which I imagine is the most important decision that they'll make along that every step of the way there, right?
There's no question. So health insurance is, from my perspective, one of the most important decisions you'll ever make, right? Buying a home, health insurance, access to medical service. First, I have to give a big shout out to the Group Insurance Commission. The Group Insurance Commission under Matt Vino's leadership has done a remarkable job of trying to simplify information in the process. So big shout out to Group Insurance Commission and Matt. The way that I think about this and the way the team thinks about this at Wellpoint is first and foremost, what is best for you? What are your medical and health needs? Number one, that's the first question every family or individual should think about. What is it that I need? Number one, if you have chronic illness, medical conditions, that's an important consideration. If you have kids, really important consideration. And so the first question is, what do I need? What do I need to buy to protect myself and have adequate access to the services that I'm going to need for my healthcare journey? The second question is there a price point? Is there a budget you need to think about? Third question is, okay, now that we've thought about those two factors, is how about the providers that I need to access, whether it's a physician, a primary care, whether it's a hospital service, whether it's a diabetes or endocrinologist. That's the third evolution. Okay, where are they? Are they covered under my plan, et cetera? And then fourth, one that most people don't think about, but I strongly recommend, is what additional services does my plan offer? Not just medical services or access, but rather health benefits like fitness benefit, social worker, dietitian, nutritionist, right? We offer those services. So take a look at the health plan benefits that are offered to you in addition to access to medical care. Why? Because those benefits enable you to live a healthier lifestyle. And then finally, are there differentiating factors that the plan offers you? Well, we have many. One of them is called Sydney Health. It's an incredible app that enables you to connect with your medical services, your claims, your telehealth, your primary care, your nurses, all in the palm of your hand.
It really is a focus on whole health, which I want to, wrap this up by talking about, but just remind everybody we're chatting with David Morales. He is the general manager at Wellpoint. UniCare is now Wellpoint, new name, same commitment to your whole health. And also we're excited because we are coming to you from the Wellpoint Studios in talking to David here. Before I ask about whole health, though, because you guys have an incredible focus, I see all your focus and your messaging and everything seems to be on that whole health. What's the biggest mistake a person will make in choosing a health plan or what health coverage is right for them? Is there a common mistake that you find that people make? Is it what I kind of said, I just take the cheapest option and we'll worry about that when the time comes that we need a provider or other medical care?
Teddy, I have never been asked that question. I love that question. Here's what I have seen in the past 4 years plus. 4 years, especially because now I'm on the health plan side. I was on the provider side, and I'm on the health plan side. But over the past 4 years, I've been thinking more and more about it. How do we enable and help and support people to make decisions that work for them? Good question. What I have found more and more over the past 4 years is that we typically tend to make decisions based on brand or word of mouth. So if somebody says, I'm not going to mention names, but they'll say, product X or company Y, my cousin said so, or, my colleague said so. Making a decision based on a brand or a word of mouth without actually doing the research, the analysis to understand the benefits, the cost, the considerations that are truly benefit for you, that match your needs, that's a mistake. And so that's the one that I hear quite often. Well, I chose it because my colleague had it, or I chose it because the name, right? I thought this. Huge. That's probably the biggest reason I hear when I tour the state.
You actually might be working against your sales team here, because the fact that you guys are the largest player in this field here in Massachusetts, obviously what I'm going to do is I'm going to say, look, I'm not happy with my plan. Who are you with? I'll say to my coworker. And if they say I'm with Wellpoint and they do X, Y, and Z for me, well, that word of mouth is also a great thing. So if you're doing something right as a company, then word of mouth is somebody else's opinion isn't necessarily a bad thing, right?
Absolutely. But as an informed consumer and as a very transparent individual, I would be remiss if I didn't say to people, look, shop around. Research, analyze what's best for you. Don't just trust me, right? Go and do the homework. But I'm pretty confident when people do the homework around Wellpoint, they'll land with us.
All right, that screaming you hear in the distance is your sales team saying, what is David doing? Let's talk about whole health. Every one of your social media posts that I see, anytime you write something about health, you're always focusing on whole health of your members. And you kind of talked about, your whole health is our whole point, your new tagline there. What is whole health for those who don't know it or haven't been watching our Health Minutes brought to you by Wellpoint?
Yeah, absolutely. Let's talk first about what it's not. For decades, for over 50 years, we talk healthcare. Well, healthcare, if you think about it, is really sick care. We reimburse, whether it's a health plan or a private insurance company or Medicare or Medicaid, reimburses hospitals and physicians when we're sick. They get paid to see us when we're sick. That's healthcare. Well, we truly believe fundamentally that we need to flip that script and move toward whole health. Over 80% of our health, what happens to us, is influenced not by a doctor, not by the hospital, but how we live, our behaviors, our choices, our diet, our fitness. And so we want to more and more start flipping the script to say, A, how do we empower our members to live healthier lives, whole health, whether it's mental, physical, social, and B, how do we partner with providers, hospitals, physicians, et cetera, to reimburse them to keep us healthy, right? We're moving that toward whole health. That's whole health.
Yeah, because if you wait till after you're sick, the horse has already left the barn, preventing that illness. But we've known about this for years. People talk about it an awful lot. It's not like it's any news, and yet getting the insurance industry to support that, to cover a gym membership, to cover mental health services. There are folks who are watching this will tell you, they tell me, no, you're on your own there. You guys are different. You especially mental health, right? You guys have made a commitment to that, like big time. Your members have access to everything they need to make sure they have a healthy mind, because you have a healthy mind, you're going to have a healthier body.
Exactly. Yeah. So I'll several things. One is credit to the Group Insurance Commission for having the foresight to say, look, we want to have robust services for our members. And so we've gone down the path of saying as Wellpoint, we're going to dive deep. We're going to do whole health, physical, mental, social, et cetera. Partner with local community organizations to drive that, enable that. Second part, though, that I want to address is, look, this is not just on insurance companies. This is on hospitals. This is on doctors. This is on public policymakers, elected officials. All of us have to make a true concerted effort to really step back and say, look, what did we build over the last 60 years in healthcare? We built healthcare, sick care. We have got to start shifting away and start both enabling people to live healthier lifestyles, eat better, et cetera. More of a focus on public health and social welfare, frankly, social well-being, and less on sick care reimbursing fee-for-service for when we get sick. We have to get preventative, right? Why? It's better for us, but there's a second big benefit, Teddy. Cost and affordability. Healthcare is extremely expensive. It can range from 20 to 40% of our pocketbook or our annual salary or cost of living, right? And so the more we move toward health and whole health, the less medical utilization and cost.
Yeah, if you can convince me to eat better and exercise more, then I won't need my heart medication and my cholesterol medication, which, trust me, folks, gets far more pricey to me and my insurance company.
Yep, exactly.
So somebody watching this and is saying, you know what, I want to at least look into what Wellpoint can do for me, because I'm not happy and I'm thinking of making a switch. There are certain periods of time, were there enrollment periods? When's the next enrollment period?
Yeah, great question. So the open enrollment for the GIC runs from April 3rd to early May. It's about a month, but April 3rd is day one. So I encourage people to check out the website, our website at UniCare. or learn more about us and about the benefits we offer.
Yeah, UniCare MA, unicarema.com if I remember. But a quick Google search will find it, and then you'll see all the Wellpoint stuff as well. All right. Any other things in the works? I mean, the brand change that was big news. You're still kind of undergoing that. What else can we look forward to for the rest of 2024 and beyond with Wellpoint?
Yeah. So a couple of things. One is the brand name, really exciting. Look for that. But in addition to that, we have a couple of partnerships coming up in the next few weeks with the Bruins and Charlie Coyle, where we're going to once again launch Face Off for First Responders. What we did there last year was we grabbed the state police, the professional firefighters of Massachusetts, Charlie Coyle, and we pulled together a campaign to raise awareness around mental health and suicide prevention. So we're going to do that again, but we added the NAPB, Jerry Flynn, another Lowell person, leader of NAPB, the police union, along with Brian Keenan, the head of the Springfield Police Supervisors. So this whole group is now focused on Face Off for First Responders. And finally, we're also going to launch First Responder Fridays, where someone from our team, anybody, will stop at a first responder, whether it's police or fire, et cetera, and on a Friday, bring them coffee, bring them pizza, bring them food, snacks, et cetera, as a way to express our gratitude.
Yeah, that personal touch goes a long way. David Morales, first of all, congratulations on all the big doings out there and your continued growth. Thank you for taking the time to join us here, and thank you for your support of Inside Lowell and local media. I know you some people just say local. You preach it and you live it. So we really appreciate that.
Thank you, Teddy. It's an honor to be here.
All right. Thank you to David, and thank you to all of you for joining us as well. Learn a little bit more about Wellpoint, formerly UniCare, but even though they have a new name, they have that same commitment to your whole health. Until next time, stay safe, everybody.